Hi, my name's Jess, and I'm a senior solutions specialist in the International Medical Recruitment Division here at Medrecruit. I specialise in working with doctors from all over the world that want to practice in New Zealand and Australia to help them not only find their role, but also to navigate the medical registration and visa processes so that they can start work and get settled in either Australia or New Zealand. We've been really fortunate here because when we had a small number of cases, we locked down hard and we locked down fast. So lockdown's not fun. Obviously, everybody wants to have the normal freedom you would have, but I think in comparison, certainly my family in the UK are so envious of the way that we've managed COVID because yes, we go hard and fast, but it means that for the most part, we've had the freedom that most people in the world just haven't had for the last 18 months. So certainly, from our perspective, we're very fortunate that we live in a really nice place. So yes, we are restricted to our local neighborhoods at the moment. But whenever you do get out for a walk, it's in a nice spot. Takeaways are shut, which tends to be pretty good for the waistline. So being a bit more creative in the kitchen. So on the whole, it's not too bad. And we're looking forward to getting back on top of the COVID situation so that life can resume as normal for us. Most people are aware that the New Zealand borders are closed for the most part. Anybody coming to work as a doctor is actually exempt from that border restriction. So doctors can apply once they have a role and they've got their medical registration approved. They can apply for what's called a critical purpose visa, which exempts them from those border restrictions and enables them to travel into New Zealand. We do have a managed isolation and quarantine requirement on arrival. So at the moment, that's being booked via an online booking system. When you look to book, it looks a little bit intimidating because it looks like there's no spaces. But actually, what we can apply for is an emergency allocation request, which has been successful 100% of the times we've applied. So the key really is to factor in the fact that you might not have a space in quarantine until 2 weeks before you depart, but don't panic. It's very normal. And as soon as we submit that emergency allocation request, which we can do 2 weeks prior to your start date, we can get a space arranged. If we're just talking about New Zealand here, they take 4 weeks. So it's 21 business days. Once a whole application has been submitted, that process is 4 weeks. Once you've got your medical registration granted, then you can apply for your visa. So the visa processing times vary somewhat. Some of them are granted in 24 hours, others take around 2 to 3 weeks. So we always factor in an absolute minimum of 6 weeks for that paperwork to be coordinated. And its submission is reliant on you completing the paperwork and also the hospital completing their side of it as well. So 6 weeks would be the minimum we would advise, and then we need to factor in the quarantine on arrival and ideally a bit of time for you to get settled. So I would say for the most part, we anticipate that process between securing a role and actually landing in New Zealand and being able to start work being a minimum of 3 months.
So doctors who are watching this, who might be interested in a role in Australia or New Zealand, what should they do now? Should they get online and send their application? What's the first step?
I would recommend speaking to our team first of all. So it's a big move, and we always prefer to have quite a detailed conversation with people so that we've got a really good understanding of your lifestyle goals, your career goals, talk through the process to make sure you're fully prepared for what's to come, talk through some of the locations we see roles in. Certainly, I remember when I moved to New Zealand, I'd never really heard of anywhere other than Auckland. Likewise with Australia, barely knew anything outside of Sydney. And having lived here for 5 years, I've realised that there is a lot more to both countries than just Auckland and Sydney. So having conversations with us about that and someone that's been through that process and understands, how it feels to be exploring a brand new place. So certainly first port of call is to have a really detailed conversation with us about what you're looking for, what's available, and how we can make that work. From there, we will request your CV, cover letter, and 3 references, which is a hospital requirement for a formal application to be lodged. So the sooner we can get those on file, the better, because at this time of year, the job market is quite unpredictable. It can be no vacancies for weeks on end, and then all of a sudden 5 come at once. So we want to make sure that we are fully prepared for when that happens, and it always does. When that happens, we've got everything we need from your side so that we can submit that application, and there's not going to be any delay in doing that, because we wouldn't want you to miss out.